Should I get a flu shot every year? I've never had the flu, and when I did have it, it wasn't really any big deal. So should I get a flu shot every year?
Absolutely.
I hate shots.
Yes, flu shot's very important. Protecting yourself, but not just yourself. You're protecting your family when you take the flu shot, and you're protecting your community. So a lot of people think, I've never had the flu, don't need it. But if you get the flu, the consequences with pneumonia, hospitalizations, those type of things, it's not worth not getting the flu shot just because you think, well, I've never had the flu before.
And I would add to that, we've had some people that we had a fairly bad flu season this year, and some people are like, I already had the flu and I didn't get the vaccine. Well, we were still recommending the vaccine because there are different types of flu. And so some patients may have had one type, and if they didn't get the vaccine, they ended up with another type. And so it's very important to get that vaccine, whether you've had it or not, if it's still that flu season time of year.
Another thing is if you may get a different type of flu, but your symptoms are not going to be as severe if you've had the flu shot, because that virus, all the viruses are a little bit similar, so it can keep your, symptoms from being as bad. We've had a really rough, challenging flu season this year. Usually we'll see a peak around December to February. However, this year we didn't see that peak until March, and it's actually still circulating here in April. The Department of Health, Arkansas Department of Health, does not even consider the flu season over. Normally we would, but there's enough circulation that they don't.
Dr. Tukin, were you going to add to that as well?
Yeah, just a couple of things. What I've observed in clinic this year, the bad flu season, both type A and type B, the people that had the flu shot were not as sick or sick as long. Without the flu shot, most of those folks missed a week of work. They were pretty sick. Several people had pneumonia. And the reason for the pneumonia, the flu virus just overwhelms the body so much that the lungs just basically fill with fluid, and you go into respiratory failure. Personally, I had the flu. I had no fever, a little bit of a cough, sick for 3 days. I didn't even think I had the flu until somebody in the clinic swabbed me. So I'm a firm believer of the flu shot. Now, the flu shot cannot give you the flu.
That's a great question. I was going to ask that. Yes.
Okay. The flu shot is made from a protein that's part of the virus, and then that protein, when you get the injection, your body recognizes it as the flu, and you develop an immune response. It's just like allergy shots. Allergy shots are just a little protein, or we call them antigens, that your body recognizes, and so then your body is able to handle that should you get the flu. A lot of older folks won't get the flu shot because they say, well, it'll give me the flu. That happened when I had it. And there used to be what's called a live attenuated virus, which was the live virus, and it was kind of mutated a little. So the theory was you wouldn't get the flu, but some people still did. Now, the flu shot currently, since you can't get the flu, your immune system recognizes that protein. You still might have an ache or two for a few days, a little low-grade fever, but it's not truly the flu illness.
And speaking as a very needle-phobic person, there are special variations of the flu shot, and they actually have a subcutaneous version that I got 2 years ago that's like a very small needle prick. And so ask your physician about that. This is a huge area of study, and physicians and the medical community are very interested in figuring out how do we protect the community better. And so every year I think the flu shot gets better, and I think that the nasal mist and some of the other variations of protection will see a comeback in, because it is such a worldwide problem and because it's still a work in progress.
Yeah, I want to add, too, talking about allergies, I can't tell you how many people I've heard say, I cannot take the flu vaccine because I'm allergic to eggs. And that, well, first of all, it's very rare to have a severe allergic reaction to any vaccine. But with flu, due to eggs, that is very uncommon. If you can eat scrambled eggs, you can probably take the flu shot. And actually, CDC recommends it, even if you have an allergy to eggs, that you should take the flu shot. If you're 6 months old on, you should be getting the flu shot. Now, if you think you have an allergy, you think you're going to have some kind of reaction, it's best to have it, not go to the drugstore to have it, but maybe go to your doctor to get it so that you can be there for a little while. They can monitor you. But I've never seen a severe reaction to flu vaccine, and I've been giving flu vaccines for 30 years.